Hi guys, welcome to my YouTube channel. It's your girl Judith Amarachi. Good morning, good afternoon, good evening. Today I'll be taking us on infertility. What do we mean by infertility? Infertility is the inability of couples to conceive after engaging in unprotected sex for over a year or plus, or 6 months if the woman is over 35 years of age. What is the incidence of infertility? It affects approximately 10 to 15% of couples that are of their reproductive age. Types of infertility. We have primary infertility and secondary infertility. What do we mean by primary infertility? Primary infertility is the most common cause of infertility that affects couples. It occurs when the woman is unable to conceive even after engaging in unprotected sex for over a year plus. And then a secondary infertility occurs when the couples they were unable to achieve another pregnancy after having a successful childbirth previously. Then what are the causes of infertility? I classify them in men and in female. Talking about causes of infertility in female, number one cause is age. It affects women in their late 30s and 40s and also affects men in their late 50s. Eating disorders, just like the case of anorexia nervosa, inability to eat, loss of appetite, or bulimia nervosa, which is excessive consumption of food, could also cause infertility. Over exercise in women could cause infertility. Endometriosis, which is known as the growth of endometrial lining outside the uterus, could also cause infertility. Excessive consumption of alcohol and smoking in women causes infertility. Hormonal imbalances or congenital absence of the ovaries could also cause infertilities in women. Then chemotherapy or radiation also causes infertility in women. What are the causes of infertility in female? In male, rather. In male, we have low sperm count. It causes infertility in male. We have another one, chemotherapy could also cause infertility if the man is undergoing chemotherapy as a result of cancer treatment. It causes infertility in male. Excessive consumption of food could also cause infertility in male. Then we have retrograde ejaculation or premature ejaculation causes infertility. Undescended testes in male causes infertility in male. Chromosomal imbalances can also cause infertility in male. Then sedentary lifestyles, wearing of tight pants or exposing the testes to a high temperature could also affect the production of testosterone that could cause what? That could lead to production of sperm. So now, what are the diagnoses? How do you diagnose infertility in both men and women? In women, you do pelvic examination to ascertain if there is presence of infertility. You do blood tests to determine if there is presence of excessive thyroid, because thyroid diseases can cause infertility in men and in both women too. So you do blood tests to ascertain hormonal imbalances. You do hysteroscopy to also determine if there is presence of infertility in women. You do HSG and transvaginal ultrasound. In men, you do blood tests, you do physical examination, and you do scrotal tests to determine if there is presence of infertility. Then what is the treatment regimen in both men and women for this infertility? Infertility can be treated depending on the cause in couples. In couples, there are so many causes that could lead to infertility, so you treat according to causes. But general treatment of infertility involves, number one, medication, the use of medication to enhance to enhance fertility. And then number 2, surgeries can be done too in men. And then number 3, you can also in female to there is IVF. You do IVF to treat infertility in women. In male, you can, there is surgery can be performed. And then also you can do surrogacy, that is sperm donor, can also be done in the treatment of fertility. Thank you very much, and I would love to have you in my next video. Thank you, and God bless you. Bye.